Welcome to this presentation of the Quality Assurance Protocol for Family Support Services in Europe. This is an evidence-based and culturally informed model for professional practice that is part of the Cost Innovators Grant funded by the European Union. I am María José Rodrigo from the University of La Laguna in Spain. I am a coordinator of the Working Package 1 on Quality Assurance Protocol. Next. In the last cost project, Eurofamnet, we established the idea of that we have to move from family support to quality family support as a right of the child and family. And in doing that, we have to follow these objectives. First, to guarantee quality in family support services by implementing a quality assurance system. That is exactly what we are going to talk today. Addressing inequalities in access, experience, and outcomes at country level and also across Europe. We have also to apply agreed principles that most of them has been already established, but also quality standards and measurable indicators aimed at improving outcomes in the well-being and quality of life in children, youth, and families across Europe. And the third objective is exactly the one we have to address today, to create a national-led collaborative scenario to identify challenges, strengths, and needs for improvement in the family support services at the country level. Finally, with all this application of the protocol, we can develop recommendations at European policy level, and then we can ensure high quality, evidence-based, and culturally sensitive family support provision. Next, please. This is the importance of the quality assurance protocol just expressed in this slide. We have to follow several steps to achieve this aim. First, we have to select the application field. In this case, our application field is family support. Then we have to establish the objectives, has been already mentioned, but then we have to move into the principles, the things that we want to achieve by doing this quality assurance protocol, and then the quality standards, that is a more specific address of the importance of the quality protocol. That means to establish the quality standards and also the measurable indicators. The two of them are the main aims of this quality assurance protocol. But in following all of this, you can achieve several outcomes for the whole system, for instance, to achieve and to gain the well-being of families, children, and families. The European Commission has expressed the need to move forward on the developments of measuring and comparing the quality of social and care services across Europe. So this is not new. There is this intention. But for doing that, we need the development and implementation of this evidence-based and culturally informed protocol. This could be a first step to gain knowledge about the quality of family support at different country levels, and then draw lessons for collaborative learning among all of them. Next. The quality assurance model is a functional model that relies on the idea that quality assurance is an embedded system of systems. Which are these systems? We got the family support practice system, the family support provision system, and the family support evidence systems. It is very important to understand all of them because we started with the family support practice system. That is the kind of systems that create the scenarios in which the family meets the professional, frontline professionals, and establish a relationship in order to follow or to achieve the needs they are presented to the professionals. That is the very first moment, and this is a very, very local scenario. But this scenario is well bounded and limited by the kind of family support provision system that is taking place at the country level. So it's very important to then move to this outside part, outside layer of the family support practice system and understand what are the quality standards for this quality support provision system. But if you just rely on the practice system and in the family provision system, we do not ensure the importance of the quality. The quality is especially prompted by the evidence system. The evidence systems take care that all the innovations, all the evidence, scientific evidence, evidence coming from the professional fields are well fitted into the other two systems, the provision system and the practice system. So all of them are needed to achieve this quality assurance model. But there is a need for an evaluation of quality standards and indicators that operate at the three systems. Because right now we have standards, especially for evidence-based programs, but not for the whole three systems. And then we have moved the creation of these national working groups that play a key role in reporting country-specific information. Now we are on board 22 countries that are precisely preparing this national working group to complete this quality assurance protocol. The protocol, this is a new tool that helps identify the strengths and areas of improvement. And then that would be very good to prepare recommendation at the national level. Next. I go now into more detail into each system. Practice system. You have on the left a definition, a functional definition of what is meant by the practice system. As I mentioned before, it's all kind of resources that are directed to effective individual, group, and community-based support that help to protect their rights, building these meaningful partnerships and address all their needs that they bring to the services and need to be covered, and strengthen their capacities. That is the general idea of this practice system. And the scenario, as I mentioned before, is a local scenario with the families and the frontline professionals. So first, looking at the components of this scenario, first you have to provide the family-professional relationships, a good relationships, not just a kind of prescriptive relationships that you say, what is the diagnosis, what has to be done, and then to ask the family how to or they should obey that. This is not a collaborative, this is not a scenario in which there is an alliance between the practitioners and the families and to establish the whole process. And in this process, what things that has to be done is the other component, is the programs, is the establishment of the programs, the use of programs, the use of interventions as part of the working plan with the families. But all of them has been embedded into the service organization. This has to decide which are the eligible families, the type of support provided, also the kind of theoretical intervention models they lie behind, and of course, the way to implement and deliver the interventions and the programs. Next. At the provision system level, remember that all what happens in the practice level has to be embedded into this provision system level. Then you find out at the again on the left, kind of also functional definition of what is the provision system. This is a coordinated and comprehensive community network with the locus of services, as well as, of course, also involving system management, creating supportive, adaptive layout of a structure, process, and relationships. And also it's very important the idea of multiple type of services and also non-profit, pro-profit social entities, but also the cross-sectoral actions that also has to be done. And then the two components are the following. First, all this provision system is based on policies and associated guidelines and legislation. This has to be created and elaborated not only at the national level, but also that comes from the international regulations. And then this is the following characteristics, at least some of them. They have to be established the kind of economical support that are supplied to the families. That is very important. But also the type of universal or targeted services they are going to select it. The type also of the network of public, non-profit, and pro-profit agencies, because there are countries that they do not have much a public domain, but they do have a non-profit and pro-profit agencies. Then we have to move, as I mentioned in the definition, across sectors and across multidisciplinary services provision. It's very important that we work in models that follow a type of transdisciplinary approach, not only based on one profession, on one disciplines, for instance, psychologists, social workers, educators, but they have to move into the multidisciplinary service provision because these are the main component of the workforce provision. Then this workforce has to be selected and promoted, and they have to be take care of the working conditions and the training that they receive. And finally, it's very important to establish the kind of approaches they have been followed. They will be just working with high needed families, or they will be prevention, promotion, and strengthening approaches also. So all these kind of things, and there are not all of them enumerated here, but they have to be followed. Then in the next slide. Then we reach the evidence system. It's the system that is not mentioned in previous accounts of assurance model, but this is critical because this evidence-based system, as they say on the left, this is also a functional definition, reflects all the formal and informal linkages, relationships, and dynamics among all the actors, that great variety of actors, capacity, and resources. And this comes the critical thing towards the production, translation, and use of evidence. This evidence comes from science, comes from the professional knowledge and expertise, but has to be transferred and adapted to the real world family support services. And that is very important to really keep that the other two systems are aligned with innovation and aligned with continuous improvement and progress. And these are the components of the evidence system. There has to be some type of structure. For instance, the collaborations of policymakers, researchers, professionals should be established and on the regularly basis. Also, there has to be evidence structure. For instance, they have to create some type of agencies that take care of the quality of the services and establish the main guidelines for that. And then there should be an advocacy for child and family participation because they are a very important part of all the quality assurance process. But then we have to take into account that all of these structures are aimed at providing a relational translation towards the system, feeding the system with that. So then we have to work with the type of evidence to be produced, transferred, and applied into the community system. We have to establish shared guidelines with the best practices and also share guidelines with interprofessional competence because we want to establish a type of workforce that should be transdisciplinary and working on transdisciplinary frameworks. And finally, we have to establish the need for implementation. It could be a right implementation of this system. For instance, we need to establish on a regular basis the evaluation of the quality of the services. That is very important. The type of evaluation also should be established, whether it is internal or external. Also, the recognition of endorsing several best practices guidelines, because we have to make sure that all the practitioners and also services and teams that are doing a lot of work for sharing these guidelines and addressing and endorsing these guidelines need to be recognized, these efforts. The training of professionals in the best practice guidelines is also very important in the lines, as I mentioned before, in the lines of transdisciplinary approaches. And finally, there should be a dissemination among professionals, families, and society at large. Next. So we come to the end, focusing again on the idea of this national working group. National working group is very relevant because there is not many chances of finding a national networking in itself. It is very useful to build shared knowledge and consensus among relevant social agents. So there are rare occasions in which people from different sectors, from different levels of the administration, from different social services or agents are meeting together. give a response or to try to reach an agreement on the type of quality assurance quality assurance model is being used in the country. So we need and we have we have embarked the national coordinators to organize and accompany the joint discussions and complete the quality assurance protocol. That would be the main aim of these meetings. And of course, your contribution will help identify strengths and areas for improvement that will be very useful to inspire recommendations for the national and the European level. Thank you very much for your participation.